All right, guys, we're going to get started. Definitely appreciate everyone coming today. I think I know most everybody in the room. I obviously see some intended speech and hearing sciences bachelor's program students here. Definitely happy to have all you guys here. This is our program, our workshop. So you want to be an SLP, speech language pathologist. We're going to start off with a little bit of a few program facts for the master's degree. I know that a lot of questions sort of focus on this. We actually weren't able to secure a faculty member here, Dr. Kathy Cox, who participated last year. She's actually going to a conference, so she wasn't able to help us today. She's traveling today, but she did give me some really good information that I put in a few slides I wanted to share with you guys. Just that are, important numbers, if you're thinking about, well, I have to get into a graduate program, I have to get through a graduate program in order to be licensed and work in this field. Okay. First thing, minimum application requirements. This is to be considered for admission to the program. You have to have a 3.0 GPA, score in the 30th percentile on the quantitative portion of the GRE. Quantitative is math. Fancy way to say that. You have to score in the 30th percentile on the verbal portion of the GRE and a 3.0 on the analytical writing portion of the GRE. Now that's kind of like a separate section where you're actually doing a couple of writing tasks. The scores are now in the new GRE scale are from 130 to 170 per section. And the analytical writing portion is a scale of 1 to 6, but you can score a half. You can have a 2.5, 3.5, 4.5, 5.5, 6. Now again, these are just minimum to be in order to be admitted. So obviously, we'll show you a couple slides later as far as more like what and who are the types of students that are getting in, but those are just, again, minimum across the board. And the GRE is pretty similar to the SAT in terms of structure, but it is a computerized test, so that there definitely are some differences. Okay, who is applying? There were 450 applications this past cycle, 250 applications for our DE program. Now that's for people who are within, I want to say it's 50 miles outside of Greenville and further away. They want to do the program that's distance ed. 200 applications came in for the campus-based program. In terms of the amount of applications, the amount of people accepted, the numbers that are involved, this program is just as competitive and as competitive up there with our PA program, probably the two most competitive programs to get into. But anyone with less than the GPA or GRE requirements realistically does not need to apply. There are some nuances there. You can't make any C's in any of your CSDI courses. So a lot of you guys are want to get into the bachelor's program, you want to start taking those CSDI classes, can't make any C's in them. Will not be admitted to our program, won't be considered for admission if you have a C in any of those courses. If you're doing them at another institution and you're kind of looking for taking the alternate track into our graduate program, and it's a communication science disorders, speech language pathology class, whatever, same thing. No C's in those. All right. One thing that might kind of come as a curveball, usually in our advising sessions, we've been talking to you guys that a minor is not recommended because a minor can hurt your GPA, right? Well, this is what the graduate program director gave me. She said a minor is highly suggested if a student majors in CSDI. Many students aren't admitted to grad programs, and you have to think about alternate paths, realistically. So, if you're in our Bachelor's of Science program and you've got, say, 38 to 41 hours of electives to fill, it might not be a bad idea to think about a minor. But again, you always want to balance that. Think, GPA. You don't want to sacrifice your high GPA because you need that to get into grad program. But at the end of the day, if you're not getting into a grad program, having a good concentration of classes in another area, having other interests, might not be a bad thing. Because again, we know we have to get into a grad program. The average student is applying anywhere to from 6 to 8 programs and taking the GRE at least twice. Definitely take the GRE twice. Definitely apply to a number of programs. You want to get as many lines out there as possible. I mean, realistically, you're more likely to catch on somewhere if you put more than just say 1 or 2. You want to get it out there. There's a lot of programs in state as well. And there's certain resources that we can kind of point you guys to where you can start looking into those programs as well. And we want you guys to get it out there, because if you did get into ECU's program, but you did get into, say, App State, or you got into Carolina, great. Okay, so who got in? 24 students were accepted into our on-campus program. There were 15 that were accepted for the DE program. So if we want to look at 39 total students that were accepted, about the 450 that were applied, means just under 9% of applicants are accepted to the program. So that's pretty darn competitive. And for the campus program, that number again was 24 accepted out of 200 applicants. So that's roughly about 1 out of 8 applicants accepted into our graduate program. So, you know, and face-to-face program, which I assume that you guys will be doing, given that you're already here. So again, very, very competitive. So what really is getting in? Who's getting in? If you look at the overall GPAs, based on the campus students here, you see a 3.72. So that's a 3.72 average amongst all the people who are not waitlisted, who were just accepted straight into the program. They had a 3.92 in their CSDI or SLP courses. So for you guys, if you're getting into our bachelor's program, or if you're a minor, these would be your core courses for those. And the verbal GRE. Now we said, again, the 30th percentile was the lowest, but you look at what the average was, the 62nd percentile. We're about a 153. Quantitative, which again is like the math portion, the 56th percentile was the average there, and that score was a 151. And then for the writing portion, 4 and up I think is pretty good. If you're 5, I think you're a very, very solid writer. But you see the average was above a 4. And that's really, really important, especially for you guys who came to the meeting with Ms. Bengali, application meeting, where she's discussing how important it is to be able to write, in these programs. I mean, there's a lot of research involved. So yes, 60th percentile. So again, definitely not the minimums. Definitely not a 3 in the writing. I don't, 3 is not going to get you in the writing score. If we looked at these numbers based on around where the 30th percentile was last year, it would probably be around, I want to say it was like a 292 or a 293 in terms of GRE score. So those scores probably just aren't going to be good enough. Now they like to go by the percentile. Our program likes to focus more on the percentile rather than the score, because people that had taken the GRE a couple years ago are still using the old, when they took it, it was on the 1600 point scale, 800 per section. So it's still, they like to compare people just using the percentile. But if you look at that average, then, the average was around a 304, and that's pretty darn good. That's pretty darn good. So, and then similarly high numbers when you're looking at the people who are admitted to the DE program, and then for some reason in Alaska, they have different set of rules, and I'm not very clear on that, but you guys aren't in Alaska, so we'll skip into that. And that's it. Any questions? Okay. We're going to go ahead and turn it over to Mrs. Emily Brewer. Emily is our SLP, who's going to be leading the workshop today. She is a speech language pathologist with Pitt County Schools, and I'll let her bring up her PowerPoint and take it from here.
I'm Emily Brewer, and I am a speech language pathologist. I work primarily with Pitt County Schools in the school system, and I serve the hearing impaired children. I typically use an auditory oral approach, so teaching listening and spoken language. I also do some part-time private therapy after school hours, so it's a great way to make some extra money, and you can kind of pick and choose your hours when you do it, when you're looking at private therapy as well. I graduated from this program in 2008, so I'm just finishing up my 5th year in the school system. I was considered a provisional student when I entered the graduate program. My first degree I got down at UNC Wilmington, and it was in therapeutic recreation. And so for my first year, I took provisional classes, so some graduate level classes and some undergraduate level classes, what you all would take as your, core composite during your bachelor's degree. I'm going to overview the field, but this is a small group. If you guys have questions, certainly let this be an open discussion. I'm happy to field any questions you have. And I love my field, and I think it's wonderful and great, and so I hope I can inspire some of you all. So kind of what is a speech language pathologist? I found this, I thought this was pretty cute. What my friends think I do, what my mom thinks I do, what society thinks I do, what kids think I do, what I think I do, and what I really do. And that is a pretty accurate reflection. So there is definitely a paperwork component to this field that you have to really think about. But along the way, you certainly get, the whole therapy experience and the whole helping part of it as well. So kind of the big picture of speech language pathology is optimizing people's ability to communicate and swallow. That's just kind of the mass general statement that I can say about speech language pathology. Some of the different settings that you can work in are the school system. You can see a really big portion of SLP's work in the school system, about 40%. And there's an ever-growing demand. You hear about school systems having caseloads that are just astronomical. We just need more people. We just need more SLPs out there. And so that's a big portion of the field. There's also early intervention and the daycare setting, which when I do my private therapy in the afternoon, a lot of it is early intervention. The company that I work for doesn't solely do early intervention, but a lot of what you'll find in the private therapy world is early intervention, or they'll contract with the school system. You also have your healthcare settings, so that's going to be your hospitals, your medical facilities, the long-term care facilities. If you're talking about making big bucks, that's where it's at. It's the long-term care facility. Home health clinics, the neonatal intensive care units, and then the behavioral mental health facilities. So they kind of umbrella the healthcare setting, umbrellas all of those particular places. The private practice, like I talked about, university or university clinics. So if you're looking kind of long-term and you want to, consider being a professor one day or doing research for the field, that's probably the placement that you would be in. And then individuals' homes or residents, community, state, and federal agencies, some correctional institutions, research facilities, or corporate and industrial settings. So you can see like some of those less common ones make up a very small percentage of what people do or where people are working. Do you guys have any questions about that? About where you can work? No?
I have a question about the school systems.
Sure.
Especially out here in rural Eastern North Carolina, are there greater needs for SLPs with the school systems or with the hospitals or even if in home health out here?
Yeah, definitely with the school system. That's one really appealing thing about this profession is you're just about guaranteed a job. There's just an ever-growing demand in the school system as well as in the healthcare industry. And you also think about the baby boomers, all these, your parents, my parents that are getting older, and that will need some of the long-term care facility, the hospital, any kind of the rehabilitative if something happens, a stroke or something like that. All of that encompasses things that are related to work that an SLP does. But certainly the school system, I think since I've started in Pitt County Schools, there has been a vacancy, just about, at least one or two positions that we could stand to fill just because of the sheer number. And as we get smarter, the need increases. So I don't know if you've seen recently about all the research about autism and how many more children are being identified as autistic. It's not because there's more children who have autism, it's that we are smarter and can identify the symptoms earlier and with more accuracy on these kids. And so as we get smarter, the need also increases for these type of services. Sure.
About the school system.
Sure.
I know there's a lot of, especially rural and farm places, you shared FLP between the school systems. how does that really work? Doesn't it get really frustrating having to go from school to school and then having to send a child there and send a child back and all that?
Sure, absolutely. It can be very frustrating. My first year, I would go to 7 schools in one day, and it was wild. And, I had to have a realistic conversation with our director and say, you're not utilizing my time to the best of my ability. I'm spending 50% of my day in a car, and you're paying me X amount of money to be providing therapy. So let's look at some ways that we can rearrange to make this, work better. But certainly when you're looking at things like the private practice setting, the money is appealing. Absolutely, the money is appealing. I get paid almost twice what I get paid hourly working for the private company than I do the school system when you break it down like that. But you're going to be traveling from home to home or school to school. So you have to take those things into account and really weigh the overall quality of life and quality of your job. But I will say, for the most part, bigger school systems like Pitt County schools or probably Wake County schools really do try and have one SLP per site. Now, the exception being some of the middle and high school kids or settings. And that is because typically, with early intervention and with the appropriate intervention in elementary school, we're hoping to kind of exit children out of the system by those later stages. And so you're hoping that the numbers are not quite as high in your middle and high school. So now I travel to have one elementary school, one middle school, and one high school. And I'm at my elementary school 3 days a week, and then I travel to my middle and high school 2 days a week. To me, that's very reasonable. I'm perfectly fine doing that. But certainly that's something you have to consider, and definitely consider when you're looking into the private practice setting. I think more and more the schools are getting condensing. Yep. As long as they have the resources.
Yeah.
I mean, like you said, some of the rural or school settings, you're going to have not as many SLPs, and they're going to have to be covering multiple sites. And so that's something that you would definitely want to take into account when you were thinking about a job placement.
Thank you.
Sure. Any other questions? Okay. So I'm not sure exactly how familiar you all are with some of the things that an SLP does. But another really wonderful thing about this field is the broad scope of practice. I always tell people who are looking into this field, if you feel like you would be bored doing one thing, there are 10 other things you could be doing within this same field. And it's wonderful, because if you ever felt like, okay, I'm burnt out of the school system, I'm burnt out doing articulation drill or this, that, or the other, you can completely change your setting and completely change what it is you're doing. And it's all within your field, which I think is a great quality of being an SLP. So some of the things are the speech, sound, and production, which I was just talking about. That's your articulation, or your apraxia of speech, just the motor planning part of the way we say our words. The resonance. When we talk about resonance, that's when you're looking at a lot of the cleft palate type stuff. I don't know if you all have ever seen the flyers on that Operation Smile, where they go, across these impaired cleft palates. There's always an SLP on the team who is helping with that resonance portion of that. Voice, you're looking more at your vocal quality, so your phonation, your pitch, your loudness, and respiration. So anything, if you have any traumatic damage to your vocal cords, vocal nodules, anything like that, that's where the voice comes into play. Fluency is just stuttering. And here at this program, Dr. Kalinowski did huge research on the Speech Easy. So that was really big in our graduate program, learning about that. Language, the comprehension and expression. This is a lot of what I do, and a lot of what the early intervention does too, is just working on language, being able, what are you able to understand, and what are you able to express. And then the cognition, that comes into play a lot of times with traumatic brain injuries or those longer term care facilities, being able to orient, being able to communicate your needs, understanding what is being asked of you. If the doctor says, what kind of medicines are you on, are you able to understand that question and answer him? And then the feeding and swallowing. And that obviously a lot of times takes place in the hospital, but as well can take place in some of those other healthcare type facilities. Any questions about that? No, that's just a brief overview, but you can see how wide of a range it is. And so I definitely think that's a true benefit for this profession. So what are some of the things that you would be doing? What could your day look like? So some of the prevention and pre-referrals, so a lot of that early intervention service, getting your data to help guide your clinical decision-making, screening. I was telling Anthony before we started during the summer with my private therapy company, we do mass screenings at all the Head Starts. And so it's a very fast-paced. You're not going to see the same clients over and over again, and it's just screening. It's just saying, okay, we need to investigate further, or you are pretty much in line with your typically developing peers. The assessment and evaluation part, and this is a big part of what I do as well, gaining information to help me make further determinations as to where we want to go with this particular child or patient or client. Consultation, especially in the school system, you're a part of a team. You're a part of a team approach, really in most all of these settings. So being able to consult with other people is a big part of what I do. Providing diagnoses, the treatment, intervention, and management, counseling, collaboration, documentation, and referral. And certainly all of these, depending upon your setting, are going to come into play in one way or another. So any questions about that? No? I would say the bulk of my time is spent in treatment. Another big chunk of my time is spent in documentation, and a portion is spent in the assessment and evaluation. And every free second I have, I'm either consulting or collaborating with other professionals that work with the same students I do. Money. How much can I make? If you look at what I provided you here, right at 77% of the people that they surveyed, this was from 2011, were making in the range of $40,000 to $80,000. So that's pretty much what you can expect to make, somewhere in that range. And I did that for the lower South Atlantic region. And so obviously as you move across the country into different locations, that number can change. I did write the resource down for you all on the references pages. If you're interested in more, if you're from California and that's where you're going back home, if you look at the advanced for speech language pathologists and audiologists, you'll be able to pull that up. So breaking it down, we talked a little bit about setting. SLPs in a school setting versus SLPs in a healthcare setting. So the median salaries for the SLPs in the school setting was 56, up to 63 in the preschool range. And then for an SLP in a healthcare setting, it was about 70. But you can see, too, that when you're talking about a school setting, you're talking about 9 or 10 months out of the year. You're not talking about all 12 months. And so, comparably per month is about the same. And, you could do something like I'm doing, work for the private therapy company if you're working in the school system over the summer and make some extra money if you're interested, or have those months free. As a student, I could not imagine having to work during the summer, so.
Can some people pick up like extra shifts doing things at the hospital as well,
Absolutely.
weekend work?
Absolutely, absolutely, and just depending on your setting, it will be the determining factor in that. But yes, like in a hospital setting, especially in like an acute care, or if you're just doing PRN work. My husband's sister is an SLP as well, and she just does PRN for the hospital. And so, she'll cover a maternity leave, or she'll go in for a shift here and there to make some extra money for their family, but she is not there full time. But, you could also have the full-time position where you're picking up a shift here and there depending on your setting. Definitely. money question. I mean, that really and truly somewhere 40 to 80 is where you're gonna fall. If you're, super ambitious and you're gonna start your own company and you're gonna have SLPs working under you, I mean, you can make as much as you wanted to. As big as you build your company is how much you can make, if that's what your desire is. But I think, just kind of standard overall, that range is where you can expect to fall.
Is it safe to say that someone who wanted to move to Charlotte versus someone who wanted to move to a rural county in eastern North Carolina, is that where the range kind of differs? Like, are you, if you move to the Triangle or Charlotte, are you kind of more on the higher end of that versus?
Typically not.
Oh, really? Okay.
It's typically, it has more to do with your setting than it does with your actual location within a region, I would say. So within this lower South Atlantic region, I think you'll find pretty consistently, within a few $1,000s, that settings are paying about the same. It's which setting you choose that will help. That is more of a determining factor of that.
Okay. So other medical professions, I know sometimes people are thinking, well, if I move to Raleigh or Charlotte, I'll make significantly more than what the average is, or I'll be on the higher end of that. So
Right.
that's sort of a myth in this field.
Right.
Okay.
And a lot of times it's almost the opposite of that, because in the rural areas, they're trying so desperately to get people that they're willing to pay a little bit more sometimes. But I think you'll find in each region of the country, it's about the same. And I mean, you can even see across the country, it doesn't range. It's not like you're making $100,000 out in California, you're making $40,000 over here. I mean, it is within a pretty, close range of each other. And experience matters too. You can see, with the less experience you have, obviously, the lower the pay is going to be.
Private companies have no benefits, most, right?
Right, well, and it depends on the company, and it depends on if you work there full-time versus only part-time or PRN. So I receive no benefits through the private therapy company that I work for, but it's because I only work there part-time. They do offer benefits if I were to work there full-time. But if you're considering PRN or that type of work, certainly the pay is higher. But you have to consider, you have to weigh all your factors. You're going to be paying out for your health insurance. You're going to be paying out for other things that, maybe you're getting a lower salary, but is covering those things. So certainly something to take into consideration. That's my handsome husband. On my graduation day. So what does it take? It's hard work, I'm not gonna lie. It is hard work. And that master's level degree, you have to have it. It's the minimum requirement. So like Anthony said, it's hard to get in, and once you get in, it's hard work. But it's worth it in the end. Some of the other things that you have to have are observation hours. It's 25 observation hours for ECU. I'm not sure if that's a national thing, like you would have to have that at every school, but I know at ECU you have to have at least 25 observation hours. Once you get into the master's program, you'll have to get clinical hours in a variety of settings. So I think the total we saw was 400 hours total, but at least when I was doing it, it was broken down. You had to get a certain number of hours in adult language. You had to get a certain number of hours in child language, a certain number of hours in adult evaluation, a certain number of hours in childhood evaluation. But it really is helpful to have the experience of working in all those different avenues so that you can really begin to find what fits for you. Once you graduate with your master's degree, your first year out will be a clinical fellowship year. And most places will accept clinical fellows. It's not it's typically not an issue. It's typically a non-issue, especially in a school setting or a hospital setting. But you do want to think about your last semester is a full-time internship. And so really thinking about, what direction you feel like you're heading